Welcome to the Families Helping Families webinar about Act 378 Community and Family Supports. I'm Wallace Johnson with Families Helping Families, and we're glad that you joined us today. And with me, I have one of our staff members, Melinda Elliott. She's our presenter today. And before she gets started, I wanted to remind everybody to please use the chat box. You're all muted. So if you have any questions for her, please submit them in the chat box. And at the end of the webinar, we will email you the PowerPoint and also watch for our survey. It should come up at the close of the webinar. But if it doesn't, in the email with the PowerPoint, there will be a link for you to do the survey if you missed it. And with that, I'll turn it over to Melinda Elliott.
Thank you, Wallace. My name is Melinda Elliott. I am the Region 5 LCAN leader. LCAN stands for Louisiana Council's Advocacy Network. And I'm also the programs manager at Families Helping Families. More importantly, I am the mother of 5 children, some of who have disabilities, and 8 grandchildren, some of who have disabilities. I'm going to jump right into it. I've turned off the screen because I find it distracting to see myself while I'm trying to talk. So y'all forgive me because you can't see me. Some of you may have heard of Act 378 Services or the Community and Family Support System. You also may be familiar with some of the services included in this system, but not know that they're Act 378 services or how they originated. I'm going to share the history of Act 378 and Community and Family Support Services system. I'm going to share what services are included and where we are today.
Okay. And before I forget, this webinar is being recorded and is live on Facebook. So I wanted to let everyone know, and I apologize for interrupting.
So the screen won't share, the screen won't move, Wallace.
Okay, you might have to reshare it.
Stop screen sharing. And then let me go back into share screen. All right. Nope. Still won't let me do it.
Do you want to email me your PowerPoint and then me try it?
And it worked just a few seconds ago.
Mm-hmm.
I don't know what the deal is.
Because I have my email up if you want to email it. And we can go from there and just tell me when to advance it.
I can email it to you, Wallace.
We apologize, everyone. We'll get it straightened out. Just bear with us. And if anyone needs the LCAN brochure and you do not have it or haven't received it and would like a copy, we could definitely email that out to you as well.
I'm going to try the screen share one more time. I just put it in the email to you, Wallace.
Okay. And I'm saving it to my desktop.
Yeah, it won't let me do it.
Okay. All right. Let's see, I got to find how to get to my desktop. What's that desktop thing? There we go.
So I'm going to go ahead and keep talking while Wallace is getting the PowerPoint up. Y'all are going to get a copy of this PowerPoint. So you'll be able to go back over parts of it. I'm on the second slide, Wallace. The Louisiana system of supports for people with disabilities has changed dramatically since 1988. Before 1988, our state had few services. A lot of states had few services for families who wanted their child with disabilities to grow up in their own home. There were families of adults with severe disabilities who wanted to live on their own, but there were basically no supports available for them to do so. The only services that were available for people with disabilities were residential or facility-based. The state would build or establish a program and then put a person in it, whether it exactly fitted their needs or not. The person would have to go to the program, or worse, even live there, in order to receive services. At that point, we had 9 developmental centers, thousands and thousands of community homes, private institutions, and sheltered workshops. You can change it, Wallace. In 1988, things began to change. The DD Council supported DD, Developmental Disabilities Council, sponsored a conference on community integration, where both parents and professionals heard how states were providing individual and family supports to children and adults with severe disabilities in their own homes. States like Michigan had the philosophy of whatever it takes to support a family of a child with a disability in order to keep their child at home would be provided to the family. And Colorado was supporting people with severe disabilities in their own homes. These presenters from other states inspired people at the conference to think, if it can happen there, why can't it happen here? So you can change again. At the end of the conference, participants were asked to dream about what they envisioned a perfect world would be for people with disabilities. People said much of what they had heard from presenters at the conference, like being able to keep their kids at home with family supports, people with disabilities living in their communities as contributing and valued members. They wrote it all down on a flip chart and taped it to the walls. Then everyone was about to leave. One of the parents, Mike Vasco, a parent from Shreveport, asked, so now that we have all these good ideas written down, are we just going to leave them on the walls, or are we going to do something about them? You can change, Wallace. The DD Council accepted the challenge, and the Community and Family Support System was born. The council formed a steering committee of parents. You can change it, Wallace.
I'm trying. I apologize. For some reason, the share is not working like it should.
Okay, that's good. Thank you. The council formed a steering committee of parents and self-advocates and other advocacy groups that set its goal of creation of community and family support system. And you have to understand that we were probably one of the leaders in the nation in forming this committee and the things that this committee was able to do. The community and family support system would be accomplished through legislation the following year. The steering committee had public forums around the state to get input on the vision and to build support. That was actually when LeCan was born, through community organizing. People like myself would start with another parent and ask that parent if they knew any other parents, and then ask those parents if they had a friend that they could bring. And it just kept building on and on from there. Regional teams began to form. The council also funded some pilot programs for family support and supported living that gave that information and data proving that people with severe disabilities could live successfully in their own homes and were cost effective. While this was going on legislatively with families, parents, and their legislators, the state had already been investigating waiver services. The state, Louisiana, wasn't getting a whole lot of response from families or a whole lot of interest from families until after this conference. But the state in and of itself was already at the forefront of figuring out waivers and how to create waivers and how to create that specific part of the system. You can change, Wallace. We were excited that I wasn't there back that far, by the way, but I know family members that were excited that in 1989 Act 378 passed with unanimous legislative support. It called for a plan for a system of community and family supports for people with developmental disabilities. And it directed the Developmental Disabilities Council to write the plan based on guiding principles included in the Act. It also listed an array of community and family supports to be made available to those families and adults with disabilities. Act 378 directed the state to implement the plan and for the council to oversee that implementation. You can change, Wallace. The council formed an advisory group to write the plan. They held public forums across the state to get input into what should be included. It took 2 years. The legislature approved the plan and provided first funding for it in 1991. The DD Council and LeCan have sought additional funding every year since then. Hundreds of millions of dollars annually are appropriated to community and family support services. The DD Council continues to see implementation. So I'm going to go over the guiding principles next. One of them is children, regardless of the severity of their disability, need families and enduring relationships with adults in a nurturing home environment. As with all children, children with developmental disabilities need families and family relationships to develop to their fullest potential. The next one is adults with developmental disabilities should be afforded the opportunity to make decisions for themselves. You can go on, Wallace, and if you can, and to live in typical homes and communities. Go on to the next one, where they can exercise their full rights and responsibilities as citizens. The next one is services to persons with developmental disabilities should be responsive to the needs of individuals and their families, rather than fitting people into existing programs. The next one, the family of each child with developmental disabilities shall be provided the support necessary so the child may live in a stable family environment and in enduring relationships with one or more adults, regardless of the severity of the disability of the child or the degree of support necessary. Another one is adults with developmental disabilities should receive the supports necessary to enable them to achieve their maximum potential through increased independence, productivity, and integration into the community. More family guiding principles. The family support system shall be flexible, individualized, family-centered. The needs of the entire family shall be considered in the development of the individualized family supports. Then the family support system recognizes that families are best able to determine their own needs rather than having their needs determined by the state or an agency. You can go on, Wallace. The system shall have a program of outreach, go on, so that families may obtain family support at the time they learn of their child's disability, and so that people are aware of the availability of community supports when the need arises. The system shall support and strengthen existing informal social networks and natural supports in addition to professional support systems. The system shall promote the use of existing community resources. So all of these principles are so important, and we want to hold the state accountable to this clause in particular, that the state of Louisiana adhere to these principles in program planning, development, funding, and implementation. When they develop policy, when they implement the policy, when they make funding decisions, they need to adhere to these guiding principles. So, the Act 378 philosophy is whatever it takes for a child to remain at home with their family or for an adult to be in their own home in the community. It's not included, those exact words, in Act 378, but it was the philosophy the system was built upon and copied from other states, and continues to be the foundation of community and family support system. So the results is that tens of thousands of individuals, you can go on, Wallace, if you can. I don't know what's the matter with our PowerPoint today. Keep going. There you are. Tens of thousands of individuals and families have received services in their own homes as a result of Act 378. Hundreds of millions of dollars are spent on Act 378 services annually. That includes individual and family support, flexible family fund, consumer care resources, adult supported living, families helping families, waiver services. All of those are in the community and family support system plan. So if you wanted a list of some of the Act 378 services, this would be a list of them. Now, waiver services were included in the law in Act 378, even though it's not tracked by the Act 378 committee from the DD Council. There's actually another committee that keeps track of waiver services, but it was part of the law. That was another one of those things that was such forward thinking by the legislators and the people in the state of Louisiana that it was put into law, that it was that important. And, one of the things that I'm excited about this state is that we thought it was that important. You could go on to the next one. The implementation and administration has shifted over the years. Initially, it was in state and central offices. Now, the OCDD stands for Office for Citizens with Developmental Disabilities, and that's what they still call it on the state level. And OBH stands for the Office of Behavioral Health, are administered through the local governing entities, the Office of Aging and Adult Services, and the Developmental Disabilities Councils. So if you ask me to repeat all the words for those letters again, I might not be able to do it, but that's what I know. The DD Council oversees implementation of those things. The DD Council's role is to ensure that Act 378 programs are implemented according to the guiding principles that are in the law and according to policy. Members of the DD Council staff participate in policy revision, in committees, in a variety of ways. The DD Council ensures that Act 378 funds are spent appropriately. So spending it all on the needs of the citizens and children with disabilities in that region, and spent on the things that they need. The DD Council also is a leader in helping the grassroots network advocate for additional funding and to protect against cuts and to assist in outreach and public education efforts. You can change, Wallace. Some of the challenges are ensuring people with disabilities and their families have equal access to services, ensuring policies are implemented consistently. One of the challenges is that depending on where you live in the state, depends on some of the Act 378 services that are available or not. Ensuring Act 378 funds are spent appropriately. Maintaining current funding. We were so excited this year that early on the legislature said that there wasn't going to be any cuts to waivers, because that's been a real possibility over the past years. And securing additional funding. When I started with LeCan in the mid-90s, I believe, the only way that you got a waiver slot was if somebody moved or somebody died, unfortunately. We've been able to get funding so that everyone that has an urgent or an emergent need basically gets help quickly. They don't have to wait years for help. Now, there's other families that know that they're going to need help in 2 or 3 or 4 or even more years, or at least think they do. But the people that need help now, as soon as the LGEs are finding them, the LGEs and the state OCDD office are able to help start meeting their needs. The unequal access part is the part about the some things are funded in some parts of the state and not in other parts of the state. And it's because the general funding levels for the local governing entities isn't even. That not every section of the state has the same amount of money to be able to meet their citizens with disabilities and the families with a child with a disability's needs. And so that it matters where you live, and that shouldn't necessarily be so. That's one of the things we continue to work on. The legislative session has been odd this year because of the coronavirus. But there weren't any cuts to waiver services. The legislators, even though we have a whole lot of new legislators, understood what was being talked about for waiver services, and were ready to assure people that there weren't going to be any cuts. So I guess the original question was, where did waivers come from? There were states that already were looking for services, developing services for people to be able to stay in their own homes, for kids to be able to stay in their homes. The few states that were working on it and had something, our state had already looked at it and was already introducing it into the state. That Act 378 conference, or the integration conference, they didn't call it Act 378. That integration conference is where it really caught parents' attention, and the parents were able to organize and lead the initiative to be able to get these things put into state law. And I believe that I am at the end. Is there any questions? I hadn't been checking the question box. Let's see. I don't see any questions. Wallace?
How can someone find out more information, about what you were talking about? I'm sure there may be people that might be new on the webinar that don't know how to get the information. What should they do? Or maybe there's someone out on Facebook that doesn't know how to get information about what you're talking about. How should they do that?
So I have a couple of suggestions. My first suggestion is you call your local governing entity. If you're in Calcasieu Parish, that is the MCAL Human Service Authority. They will talk to you, walk you through it, start you in the process. The other suggestion that I have is one of the great things about families helping families is we're all parents of children with disabilities or individuals with disabilities ourselves. So you can call our office and you can talk to another parent that's done it. For example, I have a daughter that has the specific kind of waiver she has is called a now waiver. She's also used those individual and family supports. Sometimes you'll hear it called IFS supports. But if you want to talk to another parent, you could call our office. So those are the and I could probably think of other ideas if you call me. But those are the first two major ideas that I have. Actually calling the LGE, going on their website, and calling our office.
And the way our state works, we know not everybody can get the services that they need, right away. Well, isn't there a group or something out there that advocates for them that they could join or be a part of that might help them when they're
Right.
trying to get services for their family?
Right. And I had mentioned LACAN earlier. LACAN is a grassroots organization of people with disabilities and parents and professionals and just people that care about people with disabilities, with developmental disabilities. We have a legislative agenda every year. Like I said, this year has been quite different because of the coronavirus, but we work on making the system more even. We work on getting money into the system. But people that need services right away need to be able to call their LGE, their local governing entity, or sometimes you hear people say the HSA, the Human Service Authority, and they need to be able to express that need. The way that the system is set up now, they're supposed to be able to start plugging into help rather quickly. That's one of the exciting things that have changed in the past few years. In the past few years, you got onto a list, and then, like in Domino's, my daughter's case, you waited 10 years, maybe more, to be able to get waiver services. It's not that the wait is not even remotely that long anymore. I know people that have called the local governing entity and have been able to express how dire their need is and have been able to get help within a couple of months. It's just a real exciting system now.
Thank you, Melinda.
Yes.
And our state is covered, with LACAN leaders, in different regions. So if you need further information, you can contact Families Help Families if you don't know how to get a hold of your LACAN leader. They have lots of information to share with you about what Melinda was talking about. So we would encourage you to find out who your LACAN leader is and then join LACAN, because it's free. It doesn't cost anything to join LACAN to get information, because like she said, this information is very helpful and valuable when you're trying to get services for your child or your family. And if anyone has any questions, please use our chat box. If you have any questions that you would like to ask. And if you do, we're waiting. You have any closing remarks you'd like to share, Melinda?
No. If people have individual questions, they're welcome to call their office. There's more than one of us at our office that can do a phone consultation and talk about different services that are available and or how they might need to be able to get help that they need. I don't want it to sound like a commercial for Families Helping Families or LACAN, but a lot of times families know that they need something, or that they know that something isn't working, but they don't know exactly what it is. So when they talk to another parent at our office, it helps them become clearer on those things. So they're welcome to call us with individual questions if they don't want to chat about it.
Thank you. Again, we're glad that everyone has joined us today. I don't see any more questions in the chat box. So please watch for our survey at the close of this webinar. And in the survey, if you know of any other trainings or workshops that we could offer, please include that in the survey. We would welcome your comments. Again, thank you everyone for joining this webinar. And you can go to our Facebook page or our website to see what other upcoming events we have. And we'd love for you to join us at those. And with that being said, and no more questions, we will close this webinar. Thank you everyone for joining. Bye-bye.
Thank y'all.